Hi, good evening to everybody. I was just speaking live with regards to an important breaking news about COVID vaccines being unsafe in pregnancy. That was wrong. And the first thing that I recognized I had to do once I realized that was immediately retract what I said, acknowledge the error, and then explain what it was that caused the confusion. I appreciate some of my listeners who noticed that and immediately highlighted it, for which I responded to at once and took it back. So, this is why I am here speaking about this retraction. Luckily, I was able to take that down within about an hour. But let me show you just how complex it can be with regards to understanding what is happening with regards to the science. So the first thing that you have to notice is what was being said. So here was the breaking news story that caused all of the attention. It was about the UK government website saying a vaccine is not safe for pregnant or breastfeeding women. And this was then on Twitter, and they highlighted the toxicology conclusions. And this information here actually is there, but it's still not accurate. And so this is the important bit. So when you go to the government site with regards to that, they're showing here the summary of the public assessment report for COVID-19 vaccines. Critically, it says updated 16th of August 2022. Now, as to why they did it that way, because it makes it appear that this document is a recent update. But in effect, they may have been saying that this document had just been updated on the website. And therefore, it's not making reference to the most recent recommendations and updates. And it caused the confusion because, as you can see down in the toxicology section, it was recommending that there wasn't sufficient evidence or safety requirements in pregnancy. But this was in June 2021, and it was in reference to earlier work that had been done even up to December 2020. And this is why the retraction has to come in and the clarification about what is going on. I must admit, I highlight how quickly misinformation can then complicate the whole picture because that's not what they had been saying. So when we actually go, and I have put the link here, this is from the COVID-19 Green Book, Chapter 14A. And this is recommending vaccination information for public and health for public health professionals. And this was updated on the 18th of August 2022. So this is the most recent update. And when you look at the Green Book Chapter 14A, it's talking all about the COVID-19 virus and giving information about the most recent recommendations that it will do. And when we look specifically at women, here we have pregnant women, and neonates. And what does the updated guidance from August 2022 state? It states that the risk to pregnant women and neonates following COVID-19 infection have worsened over the pandemic. So it has gone from 1.4 per 100,000 live births to 5.4. So that's about a 4 times increase in terms of the maternal mortality ratio. And so, because of that, and because of some studies around here, the proportion of pregnant women hospitalized with symptomatic COVID 19 and that experienced moderate to severe infection increased in the first wave and the subsequent waves. And this is why they would have then put in that recommendation for women. Additionally, what they have found is that in the UK, studies have shown a high rate of stillbirth in infected women. And this is again seen here. And this appears to have increased during the Delta wave. And it hasn't said anything about what happens with Omicron. And that's actually very, very important as to whether or not this approach or this thinking is still the same based on what has happened with Omicron and the lower hospitalization that occurs across the board for most people. So the point is that they still are strongly recommending vaccination for pregnancy. And in neonates, pregnant women are more likely to have severe COVID-19. They have highlighted here. And if they are overweight, obese, or Black and Asian minority ethnic backgrounds, diabetes, hypertension, asthma, or 35 years old and older, they are at high risk. And actually, this highlights one of the important points when we're talking about pregnancy and severe COVID-19. You'll see the high-risk people are across particular races and with specific comorbidities and the older maternal cohort. However, there is still a full recommendation for all women who are pregnant to have COVID-19 vaccines in order to reduce some of the complications. So the important thing, as I said, is that we have to learn whenever we make an error in what we're doing, we have to be upfront and retract it. And this is what I have done here. I had thought that the most recent information that we saw on the 16th of August was an update, and it wasn't. And so therefore, we still have very clear recommendations for vaccination in pregnancy and in neonates. And that has been clearly documented by the MHRA. So I apologize if I have contributed to any misinformation or confusion with regards to the safety of COVID-19 vaccines in the context of pregnancy. However, I still would like us to make sure that as much research that needs to be done and all the regulatory standards that should be approved, we continue to maintain those standards even in the midst of the COVID-19 pandemic. Thank you very much for listening. And again, I express my sincere apologies if anyone had seen my previous video and has gotten confused about the situation. Have a great evening to everyone, and I look forward to sharing more information in the near future.